Okay, People Before Profit are extremely proud to present this motion in support of our medical laboratory scientists, but mostly I want to just commend those medical laboratory scientists for taking the action that they didn't want to take but felt compelled to take in order to force the government to actually listen to them and engage with them. And the only reason we're here debating this is not because of People Before Profit or anybody else, it's because the medical scientists made the decision after trying every other avenue available to them, engaging with the WRC, engaging with the HSE and so on, waiting 20 years, being reasonable. Finally, they were forced to take industrial action, and it took that for the media, for the government, for politics to actually listen to them. So that's why we're here, and if anything positive comes out of the new round of engagement, it will be because of their action. And I think people really need to understand just how important the medical laboratory scientists are to the health of people in this country. Because it's not just a cliche about being the hidden heroes. As medical science and medical technology advances, and it's advancing all the time, the role of testing and analysis of tests is absolutely critical and ever more important to the accurate diagnosis of illness and to the treatment of illness. It is absolutely critical. And if you do not have enough medical laboratory scientists, if 20% of posts are not filled, or worse in many labs, when I was down at Vincent's the other day, I was talking to people in the different labs, and in some labs they were as low as 50% of the posts, in particular labs. That results in an unsafe situation, because people are having to work excessive hours, they're having to cover for those who aren't there, while their workload is increasing all the time. And the importance of the work they're doing is increasing all the time. But it's the same number of people doing it, and the posts are not adequately filled. That puts the health and safety of patients, of the public, in danger through no fault at all of the medical laboratory scientists, but through the fault of the government, the HSE and the Department of Health, who think because they're hidden, nobody really notices what's going on. So that in a sense, the government and the HSE have taken advantage of the fact that they are the hidden heroes. We have all the clapping during COVID, but in reality taking these people for granted, who are absolutely critical to the functioning and quality of our health service, and therefore for the health of people who need that service. They have again gone into discussions. But of course, when you look at the government's counter-motion, and I strongly recommend that the medical laboratory scientists do so, frankly, it's an insult. It's an insult to the medical laboratory scientists, because there's lots of praise, but then they say, extensive engagement between health management and the MLSA on the use of sectoral bargaining fund in the last number of months. However, there are insufficient funds to fully or partially resolve this matter to the satisfaction of the MLSA. Insufficient funds. That's just not true, Minister. But that's what it's about. It's about penny pinching on the part of the Department of Health, and most importantly on the part of the Department of Public Expenditure and Reform, who have been asked repeatedly to engage in this process. So, quite honestly, the Taoiseach and government representatives, in responding to the questions about this dispute, and some of us were raising this issue before the strike, appealing to the government to prevent the strike from having to go ahead by actually listening to, engaging and responding to the legitimate demands, 20 years long demands, where the pay parity they're asking for had already been recommended, and the government just didn't listen, didn't engage, didn't own up to its own responsibility of all of this, but somehow claiming the very small amount of money in reality that is involved, they just weren't willing to go there. So that's why we're here. It's the government's fault that we are here. It's the government's fault that they had to come out on the picket lines. It's the government's fault that the public health services were impacted over the last number of days as a result of the strike, because the MLSA, the medical scientists, did everything to engage. They deferred strike action earlier this year in order to again engage, but you didn't listen, you didn't respond, because you're penny pinching on actually giving these people the thing that it was already accepted they deserved, the pay parity with the clinical biochemists, and the urgency from the point of view of the health service of actually being able to retain these people, prevent them going into the private sector where they can actually get decent pay. It is the government's fault. Still dragging their heels, and still, even now in this counter motion, claiming they don't have the money when they clearly have the money. And that's one thing we learned about COVID. You know, we were told for years, oh, we don't have the money for this, we don't have the money for that, but actually billions were found. Billions and billions were found, rightly so, to respond to the COVID pandemic that we were told previously didn't exist. So the money does exist. The economy continues to grow. We had the Oxfam report this week that's showing the 9 billionaires in this country saw their wealth increase by 15 billion in the 2 years of the pandemic. Some people are doing extremely well, but apparently we don't have the money to pay the medical biochemists who are so critical to the quality of our health service. It is absolutely disgraceful. The government need to come up to the mark, and don't, when talking about that this somehow has to all work in tandem with the partnership process. The MLSA are proof about the failure of the partnership system, because they got left behind. For 20 years they got left behind because of this convoluted benchmarking system and relativities and so on, rather than actually willing to engage with the people themselves and value and respect these workers for the work they do for all of us. And of course, in a way, they are fighting for many other workers in the health service who are also undervalued, where we are understaffed across so many areas of the health service because we don't respect and treat our health workers with the respect and the value that they deserve.